Good afternoon, everyone. Welcome to our podcast. And today, the Indigenous Peoples of Africa Coordinating Committee, which is a network of 135 Indigenous Peoples organizations in 22 countries in Africa, will be discussing the impacts of COVID-19 among Indigenous peoples in Africa, with special emphasis on Indigenous women. Since the first case of COVID-19 was reported in Africa on 14th February 2020 in Egypt, it has spread to all countries in Africa now at various scales of prevalence. In Indigenous peoples' territories, we have been witnessing a slow rate of penetration of the virus into these territories, largely because of the government measures, the various measures that government took all over the continent to control the pandemic. But now with the opening of economies in most of Africa and the allowing of people to move freely to all parts of their respective countries, then we are likely to see increased cases of the pandemic in the continent. So I want to take this opportunity then to introduce our panelists. We have Hindu Umaru from Chad. We have Agnes Lena from Kenya, who is a Maasai. And we have myself, Kanyinke Sena, also from Kenya, who is the director of IPACC. So I want to take this opportunity then to invite Hindu to discuss the impacts of COVID-19 among her people so far and what she sees will happen in the coming months with the opening up of the economies, and of course to discuss a few recommendations she may have. Welcome, Hindu.
Good morning, good afternoon, good evening to everyone here. It's really a great pleasure to be in this webcast where Indigenous peoples of Africa can also have them voice and express what is happening in COVID. As all of you see, it's becoming a very complicated world. The connection needs to be through a virtual, and it is not the best one for Indigenous peoples because we don't have this accessibility, as you can know. So just to give you the general background on Chad, my community are nomadic and semi-nomadic. So we are in very remote areas and people's living independent from the environment. And now with the COVID-19, we are seeing firstly the information who becoming only sharing at the national level, I mean in the big town. And all the information are shared in the main languages, French or Arabic. And it's shared through radio and televisions and maybe social medias. And while our peoples are very far, they do not even have the correct information about what is COVID, how they contract the COVID, and why all the measures are taken by the government. They are not like included to know what is happening exactly in all the COVID-19 the pandemic. And secondly, while the governments take the decisions to close down the frontiers, so the border are closed, and they start closing down the regions, the subnational level regions are also closed down, and followed by closing all the public place as market, hospitals, and all the exchange spaces that people can meet. So from my communities and many other Indigenous communities, they do not know why they are closing these borders. And then the daily life is depend from the exchange of the product. When they go to the market today, they can sell or exchange the product in order to eat tomorrow. And when all those markets and all these spaces are closed down, it's becoming a big a big gap for the communities to get access to the basic need as food. And that sent me directly to how it's linked to the woman life, because women in the communities are the first one who is taking care of the food of the people who are normally even have headache or have cold or malaria or whatever. So they are the ones who are facing the most impact of the COVID. And I say why? Because they cannot go to the market and sell the milk that they have. And as you know, milk is a basic product that we can collect during the day. And if you didn't exchange it or you didn't conserve it for this day, you're just going to lose the product. So they can't go to the market and sell the milk. And if they didn't sell the milk, they can't buy a salt, they can't buy a onion, they can't buy a oil, they can't come back and cook for the needs of their families' food for the day. So this impact becomes very hard on them daily life, and they have just like to see, they are just like struggling to see how they can do to feed them kids, how they can do to feed the old peoples. And while this information is going on and coming back, for the women is the challenge, or okay, if someone gets sick in my community, what I should do to help them. So they are the one who are the nurses, they are the one who are the cookers, they are the one who are going to the market, and then they are getting them live in a double side from the pandemic. And in the other hand, while we are depending from the environment and my peoples are transbordering nomadic pastoralists, so the transhumance corridors are closed. And what we are experiencing actually now around the Sahel and around my region, especially in Chad, cattle start dying, sheep start dying. So that impact the food insecurity for the entire communities, because the spaces are become very dry and there is not enough resources that the communities and then the cattle can share. And it creates, again, more conflict that raising between the communities. So we do have like all the nomadic communities coming around the same waters and the animals getting died. So for us, in addition to the COVID, is going to be another pandemic who will raise up, because the animals that die can create another sickness that coming on. So the problem is really like very huge. Lack of information and lack of access to the market to exchange the product, and lack of the hospital, because we don't know and we don't have any hospital next to us. Then it's becoming like a huge issues of the food insecurities going on and on. So I stop here for the first questions. I'll leave it over to you. Thank you.
Good afternoon, everybody. Nice to see all of you here, and I miss all of you, to be honest, very sincerely. I really feel like we should be meeting face to face very soon. So there is impact of COVID-19 for Indigenous people. First of all, if I may say, it is already in the villages where I sit right now in Kajiado. We have over 70 cases of COVID-19 already, which is really high considering that it's a rural area. And our biggest problem is from Tanzania, because we are very close to Tanzania and Nairobi. So we're sandwiched in between Tanzania and Nairobi. So you get it from Namanga at the border of Kenya and Tanzania, because, you know, Tanzanians believe that there's no COVID in their country. So they are not closing the borders. They are not doing anything. Then we heard that there was an outbreak in Isili, which is in Nairobi. So people were running away from Isili to come to Kajiado, and they bribed their way through. So there's lockdown, but they still managed to come through. So our first case of corona in Kajiado town was from Isili, and then from Tanzania. And then the first girl who got infected, she's indigenous also, died. First of all, she recovered, and then after that, she died. So just want to tell you that COVID is real. and it's affecting indigenous people, and it's right here in our village. People we know are right now in hospital with their families. There's a girl who was supposed to have attended one of my seminars for the girls, but she is in hospital right now as we talk, which is very scary. So I just want to tell you that how it's affecting people, just the way Hindu said, because we are all nomadic pastoralists, there is no market. Market was shut down. So you can't buy or sell goats. And that's the only livelihood that we have, the goats and the cows. We don't even have camels here, but in Northern Kenya, they even have camels. But there's that, because of the lockdown, you do not have to buy. So what does that mean? It means shortage of food, food insecurity. And that's why as an organization, and many other organizations, and Kanyinge can attest to this, we've been supporting people with food. We've just been asking for food, because especially elderly people, they cannot move out of their houses. They cannot go anywhere. We have to feed them, literally feed them. So we were lucky. We celebrated the International Day of the African Child at our organization. And that day we were brought for food. So our community benefited again from that food. It was not a lot, but it was better than nothing. So and then something else that we've done, that's being affected is education. You know, everybody in the world right now, every child who is in school is learning at home, either through a computer like this, or a phone, or internet. We don't have any of those. We don't have electricity, we don't have internet, we don't have phones. So we had to solicit for phones for the children. We gave them some phones so that they can download their homeworks. And we installed internet in the school so that at least they can also be like any other child in Africa or in Kenya who is learning online. So everything now is online. Everything is either Zoom or WhatsApp or Facebook or, you know, internet based. So that's something that we've had to learn now with coronavirus right now. COVID-19 is teaching us that we are going virtual. And now we used to say kids cannot go to school with phones. Now we know they can. That's the only way now they can learn. And so something else that I have noticed is that it's affecting our culture. Here in Kajiado, when started, we had what we call a manyata, which is a graduation of young men into elder. And they still had another like 3 months to go, but it had to be broken. So we had to break it. So that's also culture being affected by COVID-19. That is something that's unheard of in this culture. Never heard of something like this, but it had to happen. We greet with your head, you know, the elders. I think all of you know the time we went to visit the village, remember? And you had to greet the Shah's father with the head like this. Now you can't, and you can't even greet them with your hand. And that is usually a sign of respect. And now you can no longer do that. So we're just going around talking to people, and we've been to the radios, we've been to televisions, we've been to newspapers talking about COVID-19. And where possible, we have even distributed jerry cans for 20 liters water with a tap and a soap for just washing their hands. We're doing everything we can, but to be honest, the disease is here to stay with us. Whether we like it or not, it's here to stay.
The government can include organizations like IPACC, like all the members of the IPACC at the national level, to share the information with them and to translate those information in the national language or local language that people that can understand. So all the measures that government can take must be inclusive. And the second partners are the institutions, like the big organizations, UN organizations, the civil society organization, the donor partners who wanted to invest on the COVID. So they must think about how they can invest all what they are doing, all the sustainability to be respect the COVID or to be include the COVID. For example, if there is any funding that going to the climate change, to the biodiversity, going to the human rights, going to the health, to the education, it must include the COVID components. And how it can work, if we all act on climate change now, so we must invest on protecting on our environment. That can mitigate the food insecurity, and that can respect the right of indigenous peoples, and that can include it. They can do that right now. They can just to give the funding that they do have, like to organization IPACC, like to our local organization members of IPACC, to go to the communities and just to give them the assistance that they need, the mask, for example. Everyone have to wear the mask, but the community do not have the access. With the little funding that we get through our organizations, we started giving the mask to those who are going out from the communities. And we start to give them the information about the barriers to do not let someone else to come to the communities. And to give them the information, if someone contacting the COVID, what will be the basic information to get. How to isolate the person, how to create the environment that allow the people who contacted the COVID to be also healthy and to protect the others who do not contact it. So that's need money, need support, and need trust. And it needs the immediate money to come in. And lastly, the collaboration among indigenous people. How we can exchange the information between me in Chad, like Agnes in Kenya, like Anita in Botswana, and other indigenous communities. How we can share those informations, how we can share the best practices, and how we can keep our organization moving. So that is really very important through all the partners to come together in solidarities and to come now, invest on money, invest on technique, and invest on indigenous people organization who are there. It is now or ever. We need to come all together. And that's the most important message that we can pass to them. Thank you.
So what can be done? Social protection projects. Right now in Kenya, Kenya has started a social protection project for urban areas, and of which we wish even the social protection projects should reach indigenous women and indigenous youth. For now, it's actually a project in Kenya that's reaching cities, you know, given some money for 20 days to work in a city, within the city. So the social protection projects should therefore be increased to reach even indigenous communities, indigenous women, indigenous youth, and then social inclusion in all the decisions that are being made. How are the social protection projects being decided? We are not part of it, and we need to be included, because we are the ones who know what our problems are. And so we also hope that, you know, there is a lot of proximity reaching indigenous people, so that you're not just left alone. You know, you feel lonely, you feel neglected, you feel like no one really cares. So apart from social protection projects, you also have food distribution, and it's actually happening. It's such a drop in the ocean. That should be increased. And then looking into indigenous schools, they as I said, so many of them do not have electricity. Some of them do not have internet. Some have electricity but no internet. Like what we are doing now is to provide internet for one of our little schools here, so that the kids can get their work done, because we really care for those. And of course, a lot of awareness happening, not just through, as Hindu says, not just through our organizations, but the government can also take up that.
Just to conclude on what has been said, you see that COVID-19 is really impacting on indigenous people. We expect cases of COVID-19 to increase moving forward, because now since it started, it has mostly been in the cities. But now with the opening up of the cities and the movement of people back into their rural homes and vice versa, then definitely there'll be increased cases of COVID-19 among indigenous community areas. As you guys have said, there's very, very low awareness. In fact, for the last 1 week, I've been visiting communities, and you will go to many places. You don't see indigenous people wearing masks. You don't see instruments to wash their hands. You don't see anything. They say it's a disease of the city. So there's definitely need for great awareness on COVID-19. Obviously, the issue of bed capacity is a problem in Africa, in most countries in Africa, all of Africa, in fact, and bed capacity in hospitals. And that means that as the cases will probably increase and our hospitals are not well equipped, especially in indigenous people's territories, then there will be a very, very big challenge. You have Hindu, Agnes, and Anita have deeply discussed the impact on indigenous women. They are suffering a lot. As you say, their livelihoods have been destroyed both by COVID-19 and the response measures of COVID-19. The issue of early pregnancy in Kenya now, it's an issue that in one village where I went, they are telling me that the elders were telling me that when schools reopen, less than 2% of the girls who used to go to primary and secondary school will be able to go back to school because many of them will be pregnant. Of course, there's also that issue of early marriages. So as Agnes have said, that needs to be addressed. And the only thing that I want to say that this support needs to come quickly so that we can start putting in measures urgently before it has a terrible impact on us. Thank you so much.